Diabetes is a condition where our blood sugar levels, or glucose, become elevated. Now, normally our pancreas releases a hormone called insulin, which helps drive that sugar, that glucose, back into the cells to fuel our body. But in diabetes, this system doesn't work properly. There are two main types of diabetes, type 1 and type 2 diabetes. Type 1 diabetes affects around 8% of the UK population, and we don't know why some people get it. We suspect there is an interplay between genetics and the environment. People with this type of diabetes need to replace the insulin that their pancreas would otherwise be making, and this comes in the form of injections of insulin. You also have to regularly monitor your blood sugar levels, and you have to keep it within a target range through modulating your exercise levels and your intake of food. In type 2 diabetes, the pancreas is still able to make insulin, but it doesn't work properly. As such, the blood sugar levels continue to rise and your body tries to respond to this by making more and more insulin, but eventually the pancreas becomes knackered out, overworked, overstimulated, and it's then not able to make enough insulin. Whilst most people don't get any symptoms with type 2 diabetes, some people can get symptoms similar to that of type 1 diabetes, but it tends to come on more gradually. The symptoms can be even more subtle and may just be that you're taking a little bit longer for your cuts to heal or developing infections like thrush more frequently. But it is often simply just diagnosed based on routine health checks, and this highlights the importance of attending those health checks when invited. There are a number of factors that can increase your risk of developing type 2 diabetes. Firstly, your age. We know that your risk of type 2 diabetes increases with age. Your family history. Your risk increases if you have a close family member with type 2 diabetes. Your ethnicity. Your risk is increased if you are of South Asian descent or African Caribbean or Black African descent. Blood pressure. Your risk increases if you've ever suffered with high blood pressure. Weight. Your risk increases if you are overweight, and this is of particular pertinence if your weight distribution is that of a central obesity, so that's more of an apple shape rather than a pear shape. Other associations can include alcohol consumption, smoking, if you lead a sedentary lifestyle or have other health conditions, for example, polycystic ovarian syndrome or mental health conditions. There is no cure for type 2 diabetes. However, it is possible to put your type 2 diabetes into remission through lifestyle measures like weight loss. This means that whilst you still have the diagnosis of type 2 diabetes, you've managed to achieve normal blood sugar levels without any other input. Many people with type 2 diabetes don't require medication and are able to control their blood glucose levels by keeping physically active and maintaining a healthy diet. However, some people do require medications, and there are a number of different forms out there. Some that help you lose weight, some that help to stimulate the pancreas, and others that help to reduce the blood sugar levels. Some people also go on to require insulin. Left untreated, both of these forms of diabetes can result in significant complications, largely relating to the way that the sugar levels can affect the nerves and the blood vessels to various organs. That can include to the heart, the brain, kidneys, eyes and feet. And it is why it's so important that you attend regular checkups if you are diabetic to ensure that the health of all of these organs. Living with diabetes can feel extremely difficult and isolating, and if you are struggling, it is important to see your doctor and to get help and support through various support groups out there.